We'll start with the debate. The debate is again a very interesting one, and we would have Dr. Jitendra Jethani, who's the director of the Baroda Children Eye Care and Squint Clinic, who's a very leading pediatric ophthalmologist of our country, and he's going to be talking adjustable strabismus surgery, a must for precision. So on to you, Dr. Jitendra.
Thank you so much, ma'am. Thank you for the opportunity and thank you for the nice introduction. I'm sharing my screen. Is it visible?
Yes, yes.
Okay, so to start with, I will just be speaking a little bit on what are the basic principles for strabismus surgery and why adjustable strabismus surgeries, all the strabismus surgeons. So the practical guideline is that we want to achieve long-term stability of result. So we have to take into account the long-term drift from post-op alignment, and we have to select the muscles which would give the best chance to match junctions. This is a basic practical principle of. So we would like to highlight what exactly and how exactly adjustable surgeries help. So it allows the surgeon to place the eyes in optimal position post-operatively, which are suitable for optimal long-term result. So not necessarily, the eye will not drift or it will not.
Can you switch off your video?
Outcome, but yes, it will give. Yes, ma'am, I will do that. No, I cannot. Why not? Yeah.
Yeah. No, maybe because your signal is weak.
Okay.
Your slides are not seen now.
I will just share the screen, ma'am. I'm not able to share the screen.
No, you are sharing now.
Is it visible now?
No, it is showing you have started sharing. No.
Is it visible now, ma'am?
No, not yet.
Not yet. Yes, visible now.
Back now.
Yeah.
Absolutely.
Okay. So what the point I was trying to make was that it allows the surgeon to place the eye in an optimal position, and also the surgeon can avoid having eyes in a position post-op that is not desired. Like if you, I would be showing the slide of some of the data as to what exactly I meant by this. But before that, we will take up some of the really strong indications for adjustable surgery, which are, if you want to have a proper cosmetic alignment, somebody who's actually going to get operated just for the sake of cosmesis. Although all the strabismus surgeons do make a point that it is never just a cosmetic surgery, but for the cosmetic purpose, from the patient's point of view, if patient has a deviation which is like because of the thyroid orbitopathy, and we all know that the results would be highly unpredictable, immediate post-op as well as late post-op. If the patient has come to us for resurgery, patients with double vision who want accurate, single vision, and highly demanding patients, obviously. So the common arguments that we hear in normal debates are that we are not really comfortable to go back to OR if we are doing adjustable for kids or doing adjustment in OPD, or sometimes that we don't need it as the long-term deviation is not really predictable, but it is predictable in short term. It is similar to not doing or not putting an empirical IOL in pediatric cataract. I'm just giving an analogy because we cannot predict the final outcome, which does not mean that we won't be doing something which is predictable, at least in short term. And the another argument is that immediate post-op does not change the long-term outcome. That we will again see at the end what exactly we meant by that. These are some of the basic methods with which we can do adjustable surgery, not really a point of debate. So it is just to cover the adjustable surgery. It was bow tie technique. This is sliding nose method, and then nowadays almost all muscles we can do an adjustable hand procedure in around 2002 2003. And so we have faden surgery or faden surgery, commonly known as adjustable faden, but it is actually a resection surgery. So this is just to show that, you know, most of the surgeries now in strabismus can be performed with adjustment, with adjustable. It gives a wonderful outcome, in the sense that at least immediate post-op outcome is well within your hands, and you can easily adjust it post-op if there is an untoward incidence in the sense of having a large post-op drift or some surprise drift. So this was regarding the adjustable faden. This is the data which I have borrowed from one of my mentors, Dr. Stephen Kraft, and this is just to show the post-op drift in ESO and EXO. This is another study done by him, and this is present after ESO. So see, he has not achieved orthotropia post-op because he knows that the patients would go in for EXO deviation, and these are the results. So my point which I'm trying to make here is that post-op outcome, immediate post-op outcome is in your hands, and you can adjust as much as you want to for immediate post-op, and therefore you can think of what the final outcome would be. So not really a hype. It has its own position. It is not necessarily for all the patients, but yes, specific indications do justify adjustable muscle surgery. So thank you so much. Thank you so much, madam, for the opportunity. And stop sharing.
Yeah. I just take one question with you, then we go on to the debate, and then Veena would, of course, ask questions too. But how latest have you ever scheduled an adjustment?
No, we normally post, like for children, we adjust it after 3 hours.
Okay. Now, how have you done beyond that?
For adults, so for adults, we can, so it is more important and adjustable to know how late we can do it.
Yes, yes. They're not able to get
So
you.
we have done patients as late as 24 hours.
We're not able to hear you, Dr. Jethani. We shall, you have to just add your comment once your signal becomes clear.